With the final days of Mental Health Awareness Month, which is in May, we still want to encourage Houstonians to take care of your mental health. Many people are unsure on how to access mental health services or what to expect when they do. Luckily, the Harris Center can provide you with resources and aid. Joining us today is Wayne Young, CEO of the Harris Center for Mental Health. So let's start with this first question that has actually always confused me. So there's therapists, there's psychologists, there's psychiatrists. Who do we look towards when we need help?
Yeah, I think that's a great question. I think that really a lot of the difference has to do with what their specialty is and the kinds of services they deliver. The great news is that you can start off with any one of them and hopefully get to the right help that you might need, and they can help you decide what the best support might be for your situation.
So when we are in a situation where we feel like a loved one needs help, or someone we know, how do we encourage them to seek out help?
Yeah, I think part of it is normalizing it, right? People are a little hesitant sometimes to seek supports because of stigma, because of things that they might have heard about mental health. And so normalizing that, supporting them, encouraging talking to them about how routine it is for people to access services and supports, and comparing it sometimes to physical conditions. Like, we wouldn't be concerned about getting help if our throat was sore or if we had the flu, perhaps.
Yeah, so when someone finally takes that first step, what is that first visit like?
In most cases, that first visit is going to include a pretty comprehensive assessment for that clinician, that counselor, therapist, psychiatrist to try and decide what's going on with this person, what do they need, what kind of interventions or support would be helpful. So it's a pretty robust assessment, and then a big part of that is going to be treatment planning. And it's almost always collaborative in nature. What do you think might be helpful? This is my recommendation. How do you feel about that? So it isn't directive, it's supportive and engaging.
So here at CW39, I've done a lot of interviews about teen mental health, but we haven't really touched on young children. Does the Harris Center also help with young children, and what kind of services do you provide for them, just related to trauma or also learning disorders?
A little bit of everything, frankly. We serve a lot of young people in our community. Last year we served over a little over 90,000 people in our community, from birth all the way up through the lifespan. So we have developmental services for youth who are developmentally delayed from 0 to 3, and mental health supports all the way up from that.
So we've just got a few more seconds, but I want to talk to you about young children and negative feelings. How can a parent deal with that, and is that something also that you can help us with?
Absolutely, and so it is not uncommon at all for youth and adults, frankly, to have those kind of feelings and the hesitation. So normalizing that, providing an alternative perspective, talking about negative self-talk and how to get out of that and how to break that habit, and providing alternatives as well.
Yeah, negative self-talk, that gets us all, doesn't it? All right, so we've just got a few more seconds here. Where can we reach out for help from the Harris Center?
There's a few ways. The easiest one is at our number, 713-970-7100. Also, the harriscenter.org. We have an app in the App Store that you can download. And then the new number that's been promoted since last July is 988. It's a 3-digit access code for anybody experiencing a crisis around mental health.